Cyclophosphamide is a nitrogen mustard used to treat lymphomas, myelomas, leukemia, mycosis fungoides, neuroblastoma, ovarian adenocarcinoma, retinoblastoma, and breast carcinoma. In this video, let's found. What is cyclophosphamide? What is cyclophosphamide used for? Contraindication. What are the side effects of taking cyclophosphamide? How does cyclophosphamide work? How to use cyclophosphamide? What is cyclophosphamide? Cyclophosphamide, also known as cytophosphane among other names, is a medication used as chemotherapy and to suppress the immune system. As chemotherapy, it is used to treat lymphoma, multiple myeloma, leukemia, ovarian cancer, breast cancer, small cell lung cancer, neuroblastoma, and sarcoma. Cyclophosphamide was approved for medical use in the United States in 1959. It is on the World Health Organization's list of essential medicines. What is cyclophosphamide used for? Cyclophosphamide is indicated for the treatment of malignant lymphomas, multiple myeloma, leukemias, mycosis fungoides, advanced disease, neuroblastoma, disseminated disease, adenocarcinoma of the ovary, retinoblastoma, and carcinoma of the breast. It is also indicated for the treatment of biopsy-proven minimal change nephrotic syndrome in pediatric patients. What is cyclophosphamide? Cyclophosphamide, also known as cytophosphane among other names, is a medication used as chemotherapy and to suppress the immune system. As chemotherapy, it is used to treat lymphoma, multiple myeloma, leukemia, ovarian cancer, breast cancer, small cell lung cancer, neuroblastoma, and sarcoma. Cyclophosphamide was approved for medical use in the United States in 1959. It is on the World Health Organization's list of essential medicines. What is cyclophosphamide used for? Cyclophosphamide is indicated for the treatment of malignant lymphomas, multiple myeloma, leukemias, mycosis fungoides, advanced disease, neuroblastoma, disseminated disease, adenocarcinoma of the ovary, retinoblastoma, and carcinoma of the breast. It is also indicated for the treatment of biopsy-proven minimal change nephrotic syndrome in pediatric patients. Pharmacodynamic. Cyclophosphamide is an antineoplastic in the class of alkylating agents and is used to treat various forms of cancer. Alkylating agents are so named because of their ability to add alkyl groups to many electronegative groups under conditions present in cells. They stop tumor growth, cross-linking guanine bases in DNA double helix strands, directly attacking DNA. This makes the strands unable to uncoil and separate. As this is necessary in DNA replication, the cells can no longer divide. In addition, these drugs add methyl or other alkyl groups onto molecules do not belong, which in turn inhibits their correct utilization by base pairing and causes a miscoding of DNA. Alkylating agents are cell cycle nonspecific. Alkylating agents work by three different mechanisms, all of which achieve the same end result: disruption of DNA function and cell death. Mechanism of action. Alkylating agents work by three different mechanisms. 1. Attachment of alkyl groups to DNA bases, resulting in the DNA being fragmented by repair enzymes in their attempts to replace the alkylated bases, preventing DNA synthesis and RNA transcription from the affected DNA. 2. DNA damage via the formation of crosslinks, bonds between atoms in the DNA, which prevents DNA from being separated for synthesis or transcription. And 3. The induction of mispairing of the nucleotides leading to mutations. Pharmacodynamic. Cyclophosphamide is an antineoplastic in the class of alkylating agents and is used to treat various forms of cancer. Alkylating agents are so named because of their ability to add alkyl groups to many electronegative groups under conditions present in cells. They stop tumor growth, cross-linking guanine bases in DNA double helix strands, directly attacking DNA. This makes the strands unable to uncoil and separate. As this is necessary in DNA replication, the cells can no longer divide. In addition, these drugs add methyl or other alkyl groups onto molecules do not belong, which in turn inhibits their correct utilization by base pairing and causes a miscoding of DNA. Alkylating agents are cell cycle nonspecific. Alkylating agents work by 3 different mechanisms, all of which achieve the same end result: disruption of DNA function and cell death. Dose. Malignant diseases. 4. Intermittent therapy 40 to 50 mg/kg for 00-1800 mg/m superscript 2, divided over 2 to 5 days, may be repeated at intervals of 2 to 4 weeks. 4. Continuous daily 60 to 120 mg/m superscript 2/day, 1 to 2.5 mg/kg/day. PO. Intermittent therapy 400-1000 mg/m superscript 2 divided over 4 to 5 days. PO. Continuous daily therapy 50 to 100 mg/m superscript 2/day or 1 to 5 mg/kg/day. Nephrotic syndrome. 2 to 3 mg/kg/day for up to 12 weeks when corticosteroids unsuccessful. Non-Hodgkin lymphoma. 600-1500 mg/m superscript 2/4 with other antineoplastics, part of CHOP regimen, dose intensification possible. Breast cancer. 600 mg per square meter 4 with other antineoplastics, dose intensification possible. Juvenile idiopathic arthritis/vasculitis, off-label. 10 mg per kilogram for every 2 weeks. Lupus nephritis, off-label. Induction therapy for lupus nephritis, American College of Rheumatology Guidelines, 2012. Low dose, 500 mg for 2 weeks for 6 doses plus corticosteroids, then maintenance with mycophenolate mofetil or azathioprine. High dose, 500-1000 mg/m superscript 2/4 monthly for 6 doses plus corticosteroid. Safety advice. A human fetus is most susceptible to teratogenic agents during the first trimester of pregnancy. Cyclophosphamide and doxorubicin are pregnancy category D agents. However, potential benefits may warrant treatment with these agents during pregnancy under special circumstances. Dose. Malignant diseases. 4. Intermittent therapy 40 to 50 mg/kg for 00-1800 mg/m superscript 2, divided over 2 to 5 days, may be repeated at intervals of 2 to 4 weeks. 4. Continuous daily 60 to 120 mg/m superscript 2/day, 1 to 2.5 mg/kg/day. PO. Intermittent therapy 400-1000 mg/m superscript 2 divided over 4 to 5 days. PO. Continuous daily therapy 50 to 100 mg/m superscript 2/day or 1 to 5 mg/kg/day. Nephrotic syndrome. 2 to 3 mg/kg/day for up to 12 weeks when corticosteroids unsuccessful. Non-Hodgkin lymphoma. 600-1500 mg/m superscript 2/4 with other antineoplastics, part of CHOP regimen, dose intensification possible. Breast cancer. 600 mg per square meter 4 with other antineoplastics, dose intensification possible. Juvenile idiopathic arthritis/vasculitis, off-label. 10 mg per kilogram for every 2 weeks. Lupus nephritis, off-label. Induction therapy for lupus nephritis, American College of Rheumatology Guidelines, 2012. Low dose, 500 mg for 2 weeks for 6 doses plus corticosteroids, then maintenance with mycophenolate mofetil or azathioprine. High dose, 500-1000 mg/m superscript 2/4 monthly for 6 doses plus corticosteroids.